National Macmillan Innovations Lymphoedema Specialist for Wales. Lymphedema is a failure of the lymphatic system which results in swelling, usually seen in the arms or the legs, but it can affect any part of the body, including the head and neck, the trunk, the breast tissue, the abdomen, and the genitalia as well. Obviously, if the swelling gets that extreme, it can start impacting on a person's ability to move, thus impacting on their function. And in many cases it impacts on quality of life, in that clothing doesn't fit properly, person's jewellery might not fit comfortably on them. So many ladies who have swelling of their left arm might find they can't wear their wedding rings anymore, and that in itself causes emotional distress. Lymphedema for people who've had it due to cancer treatment is quite distressing for most people, because for them it's a constant reminder of the cancer and the treatment they've had to undergo. Again, the management for lymphedema is not easy. It does require a lifetime commitment of looking after your skin, staying active, and wearing a compression garment. And it's a compression garment which causes a lot of distress for most people because it's not something you can hide. The benefits of the LVA surgery, our main target is reducing cellulitis, which is a major complication of lymphedema. It can cause redness, swelling and pain in the arm or the leg, and people feel very, very unwell and can be hospitalised as well as a result of cellulitis. So that is one of the main aims of the surgery, is to reduce the risk of further cellulitis. And so far we know from our results we've been able to reduce this risk by 97.2%. So that is a very big outcome, and it's probably one of the biggest outcomes for our patients, so that they aren't suffering the illness to do with cellulitis. One of the other outcomes, immediately after surgery, most people, and I would probably say 98%, report a reduction in pain and heaviness in their arm or leg. And again, that's a huge quality of life impact for a person who's had the surgery, in that the arm doesn't feel so heavy anymore. And then one of the other outcomes we look at, which people classify as being a cure, is not having to wear their garments anymore. And we do have 15 people now out of the 75 who've had surgery who no longer need to wear compression garments, and that is where we're calling it a cure for lymphedema. The team was very surprised at being shortlisted, and we're extremely excited and feel very honoured to be shortlisted by Macmillan for a team award.